Hello, I'm Traci Brooks. I'm a patient care coordinator here at the Veranda, and today I'm here to talk to you about one of the subjects that I'm very passionate about, and that is patient care coordination, because that's the department I work in. I love to talk about why patient care coordination is of value to the consumer. Today, we have got many patients that have more than 2 chronic conditions. And when that happens, a lot of times, you will have multiple providers and be seen by different people. Whenever that takes place, unless you're really organized, sometimes it's so difficult to keep up with all those appointments and all of those records from those practices. I had 2 examples just this week of wonderful patient care coordination to me. One thing that happens with our jobs is we get encrypted mail every day from Phoebe, letting us know every day of our patients at the Veranda who have been admitted, discharged, or been sent to the EC, or have gone to the EC for a hospital visit. So what does that do? I'm here bright and early every morning. I'm into Meditech over at Phoebe, and I'm able to, first of all, if a patient has been admitted, I'm able to send a clinical summary of care, which is a summary of their records here at the Veranda, over to the hospital, to the nurse's fax number right where the patient is in the hospital, so that they can have that to care for our patients here at the Veranda. It's all done by secure mail. So that's a gift to me, because what is going to be on that clinical summary of care is going to be your allergies, all your medications, all of your up-to-date information is sent over there so that they have that. They're not just working them with just your problem, they're working with everything that's going on with you. And you're less likely to have duplicate services done if you don't need them, so that's cost advantage. And you also are less likely to be introduced to a medication that's contraindicated, because it's all there on your chart. So it's just better quality of care. Probably before patient care coordination really came to the forefront and was being worked effectively, patients would be referred out to other providers for different services or to be seen for different problems, and a lot of times the records never were sent back. We work really hard at this point, to establish compacts with some of the providers in our neighborhood here in this area, and even far off, to say to each other, we want you to hold us accountable and we'll hold you accountable. We're going to send our medical records. When we see your patient, we're going to have you listed as part of their care team. And as soon as we see them, we're going to send the medical record where we've seen them back over to you within so many days. And we are going to hold you to that same accountability. Will you come on board and do that with us? What does that do? Well, that enables the provider to have accurate, up-to-date information at their fingertips when they're face-to-face with the patient.